Hi guys, it's Dr. Denney over at Four Paws at Fulshear. Today we're going to be chatting a little bit about your animal's eyes, so dogs and cats' eyeballs. We only get 2 of them, so this is a good conversation to have because we want to make sure we take care of them. Maddie's going to start asking me some questions and hopefully we get some questions answered.
Dr. Denney, what is the most important thing when it comes to taking care of my dog's eyes?
Early intervention is key, okay? So since we only get 2 eyes, it's kind of like when I went to go have LASIK. I was real careful about where I went, and to this day I go in for my annual appointment because I only have 2 eyeballs, okay? So the same goes for your dogs, but early intervention is always super important. If you see anything that does not look like your dog's normal eye, please get them to a veterinarian.
How does proper eye care impact the health and well-being of my dog?
So we need our eyes because that's how we see. That's part of how they perceive the world. That's also part of how some of their training works. So seeing eye dogs, that's why it's important for them. In general, your dogs need to see to be able to do lots of things. Yes, they can rely on other senses, but imagine if we take that sense away. You know, your eyes are a big part of that. I would tell you that things that you need to look out for is eyes when they're hurt or when they're not normal can be excruciatingly painful. Think about a time that maybe you got something in your eye. I mean, it is just horrible. I've had my eye scratched before and it hurts. So that kind of pain is what your dogs can feel if something's bothering them. So it's also good from a pain standpoint. We want to make sure our dogs are happy and comfortable and pain-free.
What are some signs and symptoms that my dog may have an eye issue?
It's a really great question, Maddie. So I would say probably the most common symptom that we'll see is squinting, like they're a pirate, like they're squinting at you. Okay, if you ever see that, that means that eye is hurting. It's kind of like, one time I got sand in my eye at the beach. Let me tell you, my eye wasn't open and comfortable like this. It was like this, and my husband pouring water in my eye. And it's hard to keep my eye open because it hurts. So a natural reaction to protect the eye is to close it, okay? So tearing, excessive tearing. Some breeds can have some additional tearing from allergies. So if you get eye boogies down here and this, like the tear staining, that can be semi-normal. But if it's more than what you usually see, then we need to go ahead and be seen. Red and inflamed conjunctiva, so what is that? That's this pink stuff down in the bottom of your eye, underneath your lid. If it's red and swollen, that's not normal. Eye discharge, so if your eye boogers from your pet, cat or dog, is usually like a clear, or maybe just a little bit like silvery, that's normal. If it's green and you're yellow, those are not happy colors. Those are infected colors. Those mean you need to come in and see your veterinarian. So those are some really common things. Sometimes pawing at the eye, or rubbing the eye on furniture. You can see that as well.
Why is it important to avoid self-diagnosing my dog's eye issues?
Because if you're wrong, you only get 2 eyeballs. So we really want to make sure we know what's going on. I can't tell you how many times I have clients come in days after something's happened and that dog or cat may have permanently lost vision, and I may have been able to do something if I had gotten to it fast enough. Early intervention is so key. It's also cheaper to fix a problem when it's a small problem. Once it turns into a big problem, it gets more expensive, so that's going to hit you in your wallet. So please, early intervention is super important.
How will a veterinarian diagnose a problem with vision or other eye issues in my dog?
So there's a couple things that we do. So every time that I do an exam, I have a scope up and I'm looking at the back of the eye. I'm checking the retina, the optic nerve. I'm looking at the optic vessels, making sure they look nice and normal. So that's part of my eye exam. You'll see me tap here, tap here. I'm checking reflexes. I'm making sure that the animal can perceive that something's poking him and he should blink. Another part of my eye exam, if I'm concerned for vision, is I'm going to take my finger and kind of push it towards their eye. Now, right now, I know I'm going to do this, so I know I'm not going to hit myself in the face. But a dog doesn't know that. So if my finger is coming at someone's eyeball like this, we should blink or pull away, indicating that you've seen it. Another thing that we'll do to check vision is I will cover up one eye and I will drop a cotton ball in front of the dog. And what I should see is their head should fall down. They should look. You should follow. It's called tracking. Some other eye tests that we'll do, if the eye is squinting or red, oftentimes we'll do what's called a corneal stain. We're looking for a scratch or an ulcer. If something's like cut into the eye, the stain can help show us. So those are common tests that you'll see us do. All right, thanks so much, guys. Have a great day.